Welcome everybody to Wednesdays with Wightman. We're going to be starting in a minute here. We want to honor everybody's time and make sure that we start on time. We do have a little bit of an icebreaker to get started. So in the chat box, if you could share what you think is the greatest challenge in reopening schools this fall. There you go. Yeah, so I think we have that taken care of. So on the video or in the chat box, if you could share thoughts on what you see being the biggest challenge, and we'll be starting up in just a minute. All right, well, welcome everybody. Thank you for coming to Wednesdays with Wightman. Our goal here is to share information for school administrators and other district personnel to make good decisions about how to operate schools during a very challenging time through COVID-19. My name is Greg Monberg. I am the Director of Architecture for Wightman. In addition to that, I'm also an accredited learning environment planner. I've spent more than 25 years focused on creating learning environments in schools all over the United States, from Montana to Washington, D.C., from New Orleans to Chicago, and all over Michigan and the Midwest. So thank you all for coming. We always want to share a platform for people to share ideas on what they think is working well. And no one is an expert in what's going on with COVID-19 right now. We are constantly hearing new information and sometimes contradictory information. So we wanted to provide a forum where everybody could share what they see as best practices so that we can learn from each other. And the main point of discussion today will be a panel discussion about the CDC decision tree. Recently, the CDC did put out a decision tree for schools to follow in reopening. And it is on the CDC website. And so to break it down, there's really 3 steps. And to summarize these very broadly, the first step is, should you consider opening? And reviewing the issues that the CDC outlines in step 1, it's really about gaining understanding and knowledge and having a good accounting of the expectations that are in the rules and guidelines for federal, state, and local requirements. And this is something that is literally shifting daily. Just this morning, Governor Whitmer in Chicago, or in Michigan, put out a press release indicating that a return to school roadmap, that's a very involved document, will be published on June 30th. So I think we're going to be revisiting that at our next town hall meeting. That document has not been published yet, but the governor has at least let us know there are recommended health and safety actions in place. This is really about making sure that training is in place for staff, parents, students, but also equipment. Is there PPE in place? Are there the cleaning supplies in place? And has the school itself received a deep cleaning so that it's ready to receive kids? And then step 3 is about ongoing operations. So they ask the question, is ongoing monitoring in place? It's really about having the policies and procedures in place to deal with issues as they come up, so that you're able to screen students as they come into the building. And if a staff member or a parent or a student actually is diagnosed with COVID-19, is there a process in place to help monitor and deal with that? So this decision tree with these 3 issues is going to be our main point of discussion today. And so our panel will be led by Dr. Tom Langdon. And so Tom, are you on the line?
Absolutely am. I want to apologize to everybody for not being able to make it through the miracle of the internet, but through the
can
phone
hear you
line.
great.
And you can hear me okay?
Yes.
Okay, good. All right, so yeah, I once again apologize for the fact that I'm not going to be there through the internet, but we do, actually we're stirring quite a bit today because we did get the new information. I did not know that this was coming out earlier at 11 o'clock. And in this meantime, I've talked to several superintendents about the matter and discussed it, and we're all just trying to digest what we've heard so far. It's important to remember this is just a very first initial step and the first of any guidance we've really gotten for the fall reopening at the state level. But we do have the CDC, and they've given us this chart, we call it the plan for reopening, and we've had that for some time now. And we're very fortunate to have, again, Dr. Tom Bruce joining us today to discuss pretty much all three of these levels of opening. The first is the very beginning stage, and that's when we're coming back in the fall. We've already, in the last 2 hours, talked a little bit. I've talked a little bit, and the general thought is that quite possibly schools will be going into session in a fairly normal mode in the fall, and then we will be ready once school does start to use other guidelines. So as you can imagine, we've been working on this for a week or two, and now things have changed a little bit, but some of the fundamental issues haven't changed at all. So Dr. Bruce, could you comment on the very first of the slides here when we start talking about reopening and how to have an environment that will be safe for students, but yet invitational, but also educational in a way that is impactful for them and their learning?
Just right there, there's so many pieces of that, right? Connecticut recently had a survey and 39,000 respondents, and out of the top 15 items that families, staff, and students were worried about, I think the top 13 were all about safety. So as we talk about what we're going to look like in the fall, that safety piece is going to be huge. In my circles, we talk a lot about, can we bring in our families early or share some of our plans early so they know what to expect? And a lot of that is because we understand through our own surveys that there are quite a few families that will look around for other options, or they want to make sure the environment's safe at school before they send their students. So that idea of just sharing some ideas early, almost like the back to school night, but now it's back to school with safety night. Making sure that people understand what we're going through, what we're looking at. We're looking with the CDC, we're looking at local health department guidelines and so forth to make those recommendations for our own district. Each district could be slightly different. Another piece of that, go ahead.
I was going to say sort of like a safety roundup for our families.
Yeah, right. I think that will be critical in this fall.
I do want to make sure that we can introduce each of the speakers. So next we have Sarah Proceviat. Would you introduce her?
Yeah, and we're very fortunate to have Sarah on the line today in the program because she is an expert actually with the life natural sciences, but also with the epidemiology and with just the whole aspect of the environmental piece of being safe and making sure that our staff and students are taken care of on the safety side. So Sarah, can you add to these comments?
Yeah, I can comment. So I do have a background in epidemiology, definitely not coronavirus, rabies and others, and helped develop safety programs for different companies during the SARS outbreak in Canada back in 2003-ish, I believe. Since then, been developing environmental and safety programs for different companies, different types of organizations, different sectors, and most recently, the COVID planning for Wightman.
Great. So this one, those probably, and I don't want to speak for you, but this one must be stretching you more than the other ones maybe combined with the immediate impact on, workplace and schools. Is that possibly true?
Yes. So when SARS hit way back when, it was everyone was stressed, but yet we didn't have shutdowns. So it wasn't as much of a pandemic as they had anticipated. So, you know, certain things had to shut down. You had to mitigate in different ways, but it was restricted primarily to the healthcare system and not, you know, out and about in public. So COVID is definitely something that's different to navigate. And, you know, dealing with new guidelines and new recommendations are coming out on, you know, at one point a daily basis, is something you really have to keep tabs on. And stress is definitely there because you want to make sure that, you know, the people that we're working with, whether it's our staff, people we interact with, the communities that live in and their families end up safe.
Right, and the last point is kind of an important one. If our students, something happens with our students and they come back and they're non-symptomatic, come back to their homes, that certainly is problematic, and that's been a cause of concern for some time now as we study the disease, or the pandemic. So I guess right now, maybe we could go off to the...
we want to introduce Ryan. Tom?
Okay, perfect. Now, we also have on our, again, very pleased to have on our program today, Ryan Miller, who is a GIS Manager at Wightman. And in his role there, he'll be speaking about safety protocol as well and some of the things that he's already worked on and that Wightman has worked on to stay safe during this time. So, Ryan, could you make a few comments about this issue in particular as well? First of all, welcome.
Thank you. Thank you. So for those of you that don't know what GIS is, stands for Geographic Information Systems. And I like to describe it as the science of where. So we use data, specifically location data most of the time, but in this case, a lot of other data to make good decisions. At the end of the day, when we're making any decision in life, we want the best information available. So we work with organizations to allow them to capture and analyze and manage data to use for decision making and make it actionable. So specifically when it comes to this, this data allows people to make good decisions, allows them to identify problems, monitor things, manage and respond to events that are happening, and really just understanding trends overall. At the end of the day, it really helps us, you know, again, in that decision-making process and with all the compliance involved as well. So excited to be here today. Thank you.
Yeah, we're excited to have you here to speak.
So this
So
is
Greg,
our, and we do want to get right into understanding the decision trees. So there are decision trees that are available on the cdc.gov website. One of them is for schools for K-12 and another is for daycare facilities. And as we had pointed out, there are really 3 separate steps that they identify. If you go to the cdc.gov website, each of these have hyperlinks built into it where you can get more information. But we are going to break it down and talk about each one of these steps individually before we break out into So the first step is, should you consider opening? And these are some of the bullet points that the CDC is in need to consider, and it really is about information gathering. So Tom, did you, either Tom Langdon or Tom Bruce, do you have thoughts on these bullet points in particular about how your districts might be looking at policies to be able to screen them or to make sure that you're able to protect the children and employees with higher risk for illness?
Tom Bruce, I would ask, or Dr. Bruce, if you'd be so willing to answer on your end from your district, that would be great.
Unmute. I'm going to start with athletics right now. I think a lot of districts are kind of in the same boat, hopefully. You're starting to look at practices and how to run those, and that's really our tip of the sword, or our prototype for what we may be doing this fall. So we're trying to make sure we're covering all of the guidelines, making sure we're listening to our public health officials, using CDC and a little bit of the MHSSA and making sure that we're doing the right things. That's been going very well for us. We're getting good. We're trying to push that out press-wise to make sure people see that we're operating, we're doing it safely, communicating a lot with our coaches, making sure they're trained, making sure our athletes know what the expectations are them. So again, totally different from what we did last fall, not only in how it looks, but what everybody's responsibility is. And then moving towards the school year, we're looking at, I just heard of one today, maybe you all know it already. It's called My Symptoms, MI for Michigan, and then Symptom. And it's an app that you can use for your staff. And they can go through and basically take all those check marks for do they have a temperature, have they been exposed, and all those things. And that one's free from what I understand. So we're starting to look at some of these things for our athletes. We built a Google form. So it's really simple. The coaches are checking kids in as they come in each day. And then that's kept digitally, so we're not keeping a bunch of paperwork. And we have a couple processes to make that go quickly. Spectrum Health, our local hospital, they have a similar system that they're using. It's an app on their phone. We use the same exact checkpoints that they used for our athletes. And with theirs, they can check in as an employee. You can check in each day within 4 hours of when your shift starts. So I like to think of that as we start talking about our employees in the fall. What would that look like? Do they have to check in right at the door, or can they be given an hour or two before school starts to take care of that, and then we get a digital readout of that stuff? But I think keeping all that data is going to be huge for us looking forward and figuring out how we do things better in the future.
And one of the big issues there is, of course, many schools have a lot of busing they do. So at that point, you have to pretty much check in at the bus door before you are taken to school, because it defeats the purpose if you don't get them right there at the first point of contact before they're sitting next to peers. Even if they are physically distanced, they're still going to need to be checked before that. So it just adds another angle to it.
Right, exactly right. When you talk about students, now that's a whole nother protocol, right? That's a whole nother process. One of the things we've talked about is for the last number of years, we've been spending a lot of money on security and entry access, limiting all that. And now with the talk of COVID, social distancing, checking every student and staff member in, now we're looking at, okay, well, we're going to open up all the doors to the school so we have distribution. We would also open windows and other things for ventilation during the day. So now you're going from this almost prep for lockdown to prep for COVID, which is almost 180 degrees from each other.
And the interesting thing is that schools in the fall,
on the screen,
the indication so far.
we do have a photo on the screen showing exactly what Tom just described about having multiple doors around the building, having students queue up, providing social distancing, and screening the students before they even get a chance to enter into the building. And to make sure we have enough time to get through all this, I did want to move into step 2, which is, are the recommended health and safety actions in place? And a lot of this has to do with training of staff, making sure staff, parents, students really understand what needs to be done, making sure that processes in place for cleaning before the school even opens, training people about social distancing, and making sure the right equipment is in place, that things like PPE, masks, gloves, things like that are available for people who need them. And Sarah, I think we wanted you to comment on some of these things about compliance in schools and what they might need to be thinking about to make sure that they can satisfy this step in the guidelines.
Yeah, so with these ones, when you're looking at the compliance aspects and hygiene, we're all hearing wear masks, wash your hands, cough into your sleeves or into your elbows. But it's more than that. When you're looking at facilities, you need to have a cleaning and disinfecting protocol and process in place. So, they've summed things up where there's normal cleaning, there's deep cleaning, and there's disinfecting. And You've got to have things on schedule. You've got to know when to react and pull the plug to get more done based on a potential case that's come through your facility. And you know, every time you have people in a facility, then you have to do a different level of cleaning. So there's all these things that are put into place that people really have to consider, because the scheduling and the cost implications are much greater than what we originally anticipated. Most facilities don't have you go through and disinfect every little nook and cranny that's been used on a daily basis, but that's what this is turning into. And as well as what Dr. Tom said, ventilation. You know, we do have HVAC systems equipped with HEPA filters often, but do we open up windows? No. Do we keep doors open? No. Now that's what's being recommended. It's use everything to the full capacity equipment-wise that you have there, but also get fans going, open windows, get fresh air circulating, any of these things that will disperse, or not disperse the virus, but you know, emulate the outdoors and suck out the bad and put in the good. Another tricky thing when you're opening facilities, especially with children or you know, young adults, is how do you, I don't like calling it social distancing. I've gotten where I'm calling it physical distancing, because you can still be social within 6 feet, but how do you facilitate keeping everyone 6 feet or more apart when you're limited in space? You know, what does that look like with school schedules? What does that look like with class sizes? What does recess look like, or lunch? You know, right now they're saying don't open cafeterias. So how do you handle all those things? And again, training employees and anyone that's coming in and out of the facilities on the general health and safety protocols, which that I'm finding through different experiences that's often the hardest one because of personal opinion or preference, but then compliance is what really ultimately we have to adhere to. We have to be compliant.
We actually have some photos of schools around the world that are trying to do this. We had a discussion 2 weeks ago on the Wednesdays with Wightman specifically about the challenges of social distancing and how people really need to be social in a classroom and physical distancing. So one of those images is some schools are taking spaces that are non-traditional as classrooms that might be a little bit bigger, so that they can occupy other spaces in the building, whether it's a cafeteria, a media center, a gymnasium, a large group instruction room, or finding those other spaces to allow students to spread out and have room to be able to distance physically and still have a social classroom. So Tom, did you have some thoughts on this about repurposing spaces in schools?
That's one of our.
Oh, I'm sorry, Tom, Dr. Bruce, go ahead.
Sorry, two Toms, I'm not sure. I'll keep mine short then. This is one of our initial thoughts or concepts, you know, a few weeks ago. Right now, we feel like, especially after today, it'll be more face-to-face, talking to peers in my county right now. We believe the social distancing / physical distancing may be changed by the fall, you know, as far as what does it actually look like for schools. So we'll see what happens. It's unknown at this point.
And Sarah also mentioned things like how do you feed the kids in the building? And there's been some discussion about having the teachers move and the students stay in the same room and not sending kids to other spaces if it can be avoided. This is an example of a classroom in Taiwan where all the students don't eat in the cafeteria, they eat in the classroom. They can't wear a mask while they're eating. While they have class going and they're learning, they wear a mask. But when they're being fed inside the classroom, they put up these yellow dividers in order to provide that separation within the classroom and clearly have the space to provide 6 feet of separation between the students. But they are doing what they can with the equipment and space they have available. And we do want to get to step 3, and this is probably the most involved one, and this is about those ongoing implementation operations issues and making sure active monitoring is in place, and how you're able to check on students and employees and make sure that people who are sick are staying home, and that you have policies in place to deal with that. So Ryan, did you want to comment on this one?
Yeah, I think one of the challenges with effective monitoring is really, it can often be a data issue. Dr. Bruce mentioned a lot, there's some forms that people are using, and we're doing that as well internally. But access to reliable information is vital when you're really monitoring a situation and you need to take action. So at Wightman, we've implemented an internal pre-screening process. So if you are leaving your house for work or going to a job site, you need to fill out the form. It can be done on a mobile app, as you see there in the image. And there's a lot of other solutions out there beyond this one. But it asks a series of questions, the standard CDC questions about if you have any symptoms, if you've come in contact with others that have symptoms, if you've traveled outside the state, and then if you have a temperature after taking your, if you have a fever after taking your temperature. So in this case, if there are any answers yes to the questions, we have information being sent to specific people, and it could be HR or your manager, so they can stay ahead of compliance and they can stay ahead of those conversations that may need to happen. HR has access to the private data. I know there's some HIPAA regulations that are involved in this too, so it's important to keep that private. And it's still consumable and actionable for them as needed. We also are implementing a visitor form. So this is another way we're using this to anyone that enters our offices. Right now it's by appointment only, but this can also be used to track that information and track things down for the contact tracing if needed. But specifically to the last bullet point, we've been working with a lot of local health departments and using some local data and state information and creating these infographics and dashboards. There's an example on the slide. And this really helps kind of communicate that complex data behind the scenes. There's a lot of spreadsheets being created and managed, but that's not really easy to consume when you look at it. So these present some information that we all need, but it's in a simplified manner. And this can really, help us understand the impact of COVID-19 on a much, more local scale. So I think that there are a lot of tools out there to help in this process that make this a lot easier.
When it comes to that ongoing compliance, every school is doing it differently. Certainly those electronic tools are very helpful so that you don't have to create a lot of pain on that daily screening. This is an example where at the school, they have all of the students walk through a shoe scrubber. So they actually disinfect the students' shoes before they walk in. They have hand sanitizing stations and make sure the students sanitize their hands. They make sure they're wearing a mask. They take their temperature, and then they're allowed to enter. And so depending upon the policies and procedures in place, it can be really involved just getting the students in, and then how do you track that data? And I think those electronic online tools are critical to being able to make sure the screening is in place and it's being recorded effectively. So what we wanted to do in order to have a discussion about each of these three steps, we covered a lot of information really quickly. We did want to do more of a deep dive by having a series of breakout rooms. And so we're going to have 3 breakout rooms in Zoom for everybody to contribute to. And the 3 rooms will tackle each of the 3 steps independently. So basically, room 1 will deal with step 1, which is gathering all the information and knowledge you need for what the local, state, and federal requirements are. Step 2 is about compliance. It's about making sure that you have the training in place, equipment and supplies, deep cleaning and so forth. And then step 3 is about ongoing operations and policies and making sure that you have monitoring in place. So Christine, if we're ready, I think we want to try and break into those rooms. And so we'll have rooms 1, 2, and 3, and we'll cover those steps 1, 2, and 3, and then come back and share what we've learned in the breakout rooms. Does that work for everyone?
Sure, Greg. I'd like to remind you and Tom and Casey to please hit record once you enter your breakout rooms. I'll open the rooms right now.
Great, thank you.
You covered some of these questions kind of as we were kind of going through it, but just for the sake of, I think, taking notes and documenting some stuff, I'll probably touch base with you a little bit more.
Yeah.
Can you see my screen?
Yes, I can.
So we got tasked with the step 1 question, which is, should you consider, opening in the fall? And obviously with the governor's release this morning, we know that probably a lot of this will be covered and changed over the next few weeks when she gets ready to release that at the end of June. But a few of the topics for, should you consider opening in the fall will be, will you be consistent with state and local orders? Is the school ready to protect children and employees with higher risk for severe illness? And are you able to really screen your employees, and children upon, arrival to the school? So I guess we'll just kind of start at the top there, and I'll describe as you go. So as far as, being consistent with state and local orders, I guess from your point of view in your school, how do you guys feel like you're handling that or looking towards dealing with it?
So we will use the orders from the CDC and MDE guidelines to basically what do I want to say? Set up, what our boundaries, what our guidelines are, without using the word guidelines again. Also for us, we are going back to our strategic plan, the district strategic plan, making sure we're sticking close to that, while also surveying our staff and families on what their needs or interests are, and trying to blend the two.
Right. So you touched a little bit on, reaching out to the press so that you can, let people and families and everyone know that you are, operational and you are adhering to these safety guidelines. What are you doing as far as kind of releasing that information other than just going through press? Are you sending I'm a mom, so I'm getting, mass emails from my kids' schools and whatnot.
Yeah, so my plan over the since COVID emergency closure has been to write a Sunday evening letter or Sunday afternoon letter. We call it Sunday Bear News because we're the Bears.
Okay.
And talking to public information people and my school board, it makes sense to continue doing that Sunday letter throughout the summer because the budget is so unknown and the educational environments are so unknown. That way they're not getting surprised in August, like, hey, guess what? We laid off a bunch of teachers and we're not having school anymore, right? I'm being funny, but it will look vastly different to them in the fall than it looked last year. So we want to keep them exactly right. No surprises.
Okay. Let's see. So as far as protecting children and employees with higher risk for severe illness, this one gets a little bit touchy because there's, HIPAA laws, and how do you adhere to those and still make sure that you're getting the information out, but not getting it out too publicly.
Yes.
So I guess, how are you addressing those concerns, and, what kind of options are you providing staff or students to give them, options as far as telework or virtual learning or whatnot? So open up the floor to you there.
Our first step right now is basically the surveys. So we sent a survey to all families and left it out there for a week and had almost 1,400 respondents. And then we sent it out another one to our staff. And in both surveys, it asked, do you have pre-existing conditions, or are there pre-existing conditions in your household that would prevent you, from feeling safe, that kind of idea.
Sure.
And in the family one, it was 20%, and in the teacher one, it was 21%. So you can say right there, you're going to have, a fifth of your people are going to have some kind of concerns. So then another option for us is offering choice or remote learning for our families that don't feel safe right now. And then for our staff, it's more about asking them, so if we follow CDC guidelines, health department guidelines from our county, and we're able to put all these things in place, would you still feel safe coming back? And if the answer is no, tell us more about that.
Sure.
And then we have teams planning right now. They'll plan through the summer of, what does instruction look like? What do operations and facilities look like? And what does health and wellness look like? So those three committees everybody's using across the state and probably across the country. But the idea is we'll use that data and information from our staff and families to try to get more granular about what our plans look like in the fall.
Okay. What are your plans, I guess, as far as making sure everyone is aligned as far as, etiquette, protocol, and safety procedures, hand washing and whatnot, so that everybody's kind of on the same page with that?
Yeah. I think number one, when you say everyone, the superintendents in Berrien County meet frequently, and when we talk about this a lot. So hopefully all of the districts in our county will operate the same way, maybe even the same videos, maybe even the same expectations. So families across the county don't have to shop for a school that looks safer than another one. So that's important to us. Number two, as a district, this now becomes, in the first few days of school, we always go back to, this is how you line up in a line. This is how you drink from the drinking fountain. This is how you transition from class to class. Now it's going to be, this is how you wash your hands. This is how you wear your mask. This is how you, physical distance. I'm guessing it will be those kinds of things now, in addition to what we've done in the past.
Mm-hmm. Sure, that makes sense. And then I think the last question, I guess, in this bucket of stuff is, how are you dealing with screening employees upon arrival? And you touched on that a little bit with the app that you kind of implemented. But just for documentation purposes, if you can just maybe reiterate that a little bit.
Sure. We would like to have a free app that uses CDC guidelines or our county health department guidelines that we could issue to all staff. So one, we can collect the information that everybody's okay, but two, have a protocol when they are not okay, whether it be during the day after they've already checked in, or in the morning when they have checked in and they're not considered healthy, I guess. I don't know what that term would be yet. But I mean, that opens a whole nother set of doors, right? It's a whole nother process if somebody fails that little checklist. Mm-hmm. And so we need to figure out what that is. And then really, how do we take care of our people? I assume somebody comes down with something that's, let's just say she's a fourth grade teacher and a team of, 4 to 8 other fourth grade teachers. They all know each other's dogs and kids, and she comes down with that. There's going to be a whole sense of loss there too. So I'm sure there'll be social emotional support, as well as how do we fill that position for 14 days? There is a teacher shortage. It's real. There's also a substitute shortage. That's real. And there's also a shortage of students in the pipeline from our colleges to be teachers. So, one of the superintendents to the south of me had 2 custodians went out sick with fevers. And it may be nothing, but at the same time, if you lose 2 custodians in a small district, that's probably half your force. So now,
Mhm.
how are you cleaning? How are you disinfecting? Where do you get the people to do that work? They can come in and pick it up and do it now.
Yeah, pick it up immediately, which is
Yeah.
a good thing.
Right.
Okay. Well, I think we hit on, I think, the topics there. I don't know if you have anything else that you feel like is, we're going to go back after we get out of these breakout sessions, and I'll probably just do a brief overview of this information we covered. If you have anything else you think we need to touch on as far as what you as a district are doing.
Nope, that's pretty up to date right now. With that thing from the governor today, I had a meeting with 5 of the superintendents here in Berrien County, actually it was almost during that. And what we talked about was you almost cannot do social distancing the way it's written right now and go back face to face.
Mm-hmm.
So it seems like they're going to flex on that somehow. So I know for businesses, like if I work at a lawyer's office and I work behind a desk as a receptionist, I don't have to wear a mask unless somebody comes up to my desk or I'm getting
Right.
close to somebody, right? But if you're a visitor, then you have to wear a mask the whole time. So I feel like they're going to be making these adjustments through the summer, and they'll continue to collect data on how that's going. And I think that will inform what that social distancing looks like in the fall for school.
Yeah, a lot of the difficulty right now is the ever change. It's like they change daily, every day it's something new, and keeping up on that, and it's a lot.
Yeah. So interesting. It's always interesting.
Mhm.
Just no shortage of communication or work, that's for sure.
Yeah, if it's not one thing, it's another.
Yeah.
Well, thank you. I appreciate it.
You're welcome. Casey, what do you do there?
I do interior design.
Oh, I did check that last time, I think.
Yeah, so I have spent my last probably 2 to 3 weeks on our return to work office plans. We just phased in, the first few people came in last week, and then the next phase hits a month out, and we're kind of just going month by month, and where do we need to put panels, and how do we keep that 6-foot diameter? And it's a lot.
So how are people feeling at work? When you go to the grocery store, you can go to one store and hardly anyone's wearing a mask. You go to another store and they're all wearing masks. How does that feel at work as people start coming back?
Yeah, I think it's hard to know at this point. I mean, when masks first got implemented in stores and I started wearing one, I felt very awkward. But now I go in there, and if somebody doesn't have one on, it's almost the opposite at this point. Like, oh, why aren't you wearing a mask? So it'll be really interesting to see how the workplace adjusts to that. And, Wightman's been super supportive and flexible about you work from home if you're more comfortable with that, which is nice. And I think that will continue to probably move more to the forefront of people working from home versus working in the office, or splitting their time, how to balance that.
Yeah. So the last few times I go into a Meijer or something like that, and there's normally somebody sitting there making tally marks as people walk in the door.
Mm-hmm.
And I've been talking to them every once in a while now, like, so how's the data?
We getting any
Kind of
better?
a data guy anyway. And it's always interesting. They're like, well, certain days everybody's really good. Other days people are bad, or sometimes it's time of day, or
Yeah, I'm sure it varies greatly.
it's pretty interesting. But I'll tell you, if they're actually collecting that, it would be pretty interesting.
Mm-hmm.
All right, here we go.
All right, heading back. Thank you. Appreciate it.
Bye-bye.
Okay, so we have 3 people so far in our room. Well, we want to deal with that issue number 3, which is the ongoing monitoring in place. So I know, Ryan, that's something that I think you're very much the expert in, is understanding how to make sure that the information is being recorded and screened effectively. So what are your thoughts on schools trying to deal with that in reopening this fall?
Yeah, it sounds like from what Dr. Bruce had to say that, you know, this is already being discussed and talked about. I know this is being applied in a lot of private businesses as well that are already open. And also, we've been working with local governments to apply some of these practices. And I think, you know, at the end of the day, you know, I think this conversation happens a lot about paper versus digital. It's really about having that information at your fingertips to make something, you know, as I said, actionable and prompt. Contact tracing is very important in this, you know, during this pandemic, and having information to make informed decisions to say that, you know, this person had symptoms on this day, and you know they came in contact with this person. It's really, really important to make that an effective protocol and being compliant with regulations. So I think these are great opportunities to use technology, and having that data on the back end is really going to pay off dividends when you do have issues that come up and you need to answer those questions.
So we have another person on. You're on by phone, so I don't see your name. Could you introduce yourself?
Yes, hi, I'm Ruth Fuentes, and I actually work for a community mental health. So I go into all the schools to see kids, and so I'm very concerned with how this is going to work, and especially things like contact tracing. If I go into a school, they'll know I came in because I signed in, but then how that's going to work.
Yep. Some other interesting tools that we can use that I've seen, especially when you're coming in contact with a lot of people. There are apps that we can have on our phones, and I know there are some watches out there too that people have been using. That in I believe the big phone companies like Apple and some of the, you know, Android ones have been integrating this into their phones. But if you come in within a certain distance of someone, it records that information on your phone. So if you need to look back and see who you were near during that day, or maybe a student in that case, you can really look back and kind of use that information to say, all right, these are the people we need to talk to in this case, in case of a positive test, or I guess it just makes it a lot easier to really track things down, have those conversations, and it's, you know, make it timely. Otherwise, you would have to kind of think back, and I mean, you're not really paying attention to who you're, you know, walking past or coming in contact with. So some of these tools can really help in that process, I think.
That's
Right,
really
thank you.
interesting. That kind of technology wouldn't have been available even just a few years ago to be able to report it and be able to find those points of contact. You know, if you tried to do that by pen and paper, it would be impossible.
Yep.
So some of the other points were develop and implement procedures to check for signs and symptoms of students and employees daily upon arrival if feasible. And from what I've heard, most commonly they have no-touch thermal scanning thermometers, so that you know, they can actually have one here where you can take people's temperature before they even enter. I don't know, Ryan, have you seen other technology like that for scanning in terms of checking for symptoms?
Yeah, I've seen some thermal cameras that some businesses have been using too. So a lot of businesses use cameras for facial recognition as well. They're able to allow certain employees into a building and certain ones not, if you're, you know, not on the list. But there's technology out there with cameras that can be applied when someone steps into the view of the camera. It can detect their temperature if it's elevated or if it's not at that point. So that's another one that I've heard of. I think the handheld one that you mentioned is pretty common and very effective to, you know, keep that distance and still be able to take that temperature. So those are the ones that come to mind right now.
And the next one is encouraging anyone who is sick to stay home. And I think that's a pretty obvious one. So often in the workplace, there's a lot of people that want to come in to work even when they're feeling down a little bit. And particularly with teaching staff, that can be a real challenge of finding enough substitute teachers. You know, if students stay home, that's one thing. And I don't even think we're sure of exactly how many parents are going to choose to send their kids to school if they don't believe it's safe. You know, there might be a lot of parents that decide to keep their kids at home. But then teaching staff, it's important to have the policies in place that allow teachers to take the time off when they need to, and to have substitute staff available to make sure that they can stay home.
Yep.
And that's really the third point, is having a plan in place that if students or employees get sick, can they stay home? And what do you do? I saw that the AA, SA, and ASBO both put out a joint study about how to deal with that, because their feeling is that if somebody gets sick, or if that a school has a breakout, they might have to shut down for several days and do a deep cleaning of the building, have testing take place so that they can check whether people are healthy or not. And, you know, maybe it's even beyond the virus, and checking for antibodies if people had previously been sick and might have some immunity. But having that whole procedure in place, what if somebody does test positive? What if they have to stay home and they're sick? How does that impact everybody else? Can you still operate the school and keep it open? And then the next one has to do with regular communication and monitoring developments with local authorities, and making sure employees and families regarding cases, exposures, updates to policies and procedures are made aware of things. And I think that online dashboard that you were talking about is really an excellent way of making sure everyone in the community is getting the information that they need. So if you want to talk about what you're doing right now with the county, for example.
Yeah, so with Berrien County, we're working with their health department, and I think Lakeland or Spectrum, whatever they're called now, is still involved in this conversation too, but also with the county GIS department. And they've created a dashboard publicly, and one that's private that has some more information, some more details behind it for their internal uses. And they make that available on their website. It's updated every day with the latest information from the last 24 hours. And it's really valuable to see it simplified in a manner like that, because not everyone can look at that data and, you know, understand it. When you look at charts and graphs and maps, for that matter, it really jumps out. You know, it can make things a lot easier to understand and use. So we've been working with them specifically to help automate that process of the daily updates, so they don't have to manually go in there, type in the information to make sure the dashboards update. We've built some scripts and some tools to run every day at 3 o'clock that updates that information on the dashboard. So it saves them a lot of time to do that every day.
And so it'll be interesting if something like that can be worked out on the school side. The government, cities, towns, counties have been reporting the information. The state has been doing that for the general populace. It'll be interesting to see how that information could be similarly tracked across all of the schools, so that especially if someone has to go from one school to the next, that they can understand what's going on at each of those.
Yeah, that'd be very important.
A lot of families have kids at different ages, and they may have to visit more than one school. And, you know, if one family gets sick, suddenly that can cross-contaminate across multiple school buildings as well.
Yep. And then, yeah, I think the important part is there that it's actionable. If you can see that quickly, right? You don't have to go back into the paper documents, look through them, find information. It's something right in front of you that is near real time. So it makes that a lot safer in the end as well when you're making those decisions.
So Another point that the CDC has made is monitoring student and employee absences and having flexible leave policies and practices. That's something that has been more of a hard and fast rule in the past, because certainly employee absences are usually governed by the contract with the teachers, and students are only allowed so many absences in a year and so forth. And so a lot of that is going to have to be fundamentally rethought, and what has been standard practice in the past, even in some contracts, may have to be rethought. And then the final point is be ready to consult with local health authorities if there are cases in the facility or an increase in cases in the local area. And so having that information being shared between the schools and the local health departments, whether it's at the county level or within the city, is really critical. And so some of the GIS tools that you've been working on will be able to share across platforms between educators and education side and the governmental side.
Yeah, I think the fact that the organizations are taking the steps to go that digital route puts them in a great position to be able to share that. So we all know that's going to be important to share that with other levels of government and organizations. So data is power, and you know, the ones that are taking the steps, this will be pay a lot of dividends in the end, and I think it'll be a great thing overall. So I don't know if I have any other points doing that. But.
Yeah, and then we don't even know what's going into the statewide policy that the governor is working on right now. That was just announced this morning that they've gotten to a point where they're going to be issuing it on June 30th. But we've been told that it's a very involved, fairly thick document. And hopefully that will provide clarity on how schools and the local governing bodies will be able to share that data and cross-communicate. I don't know that anybody has that in place right now.
Right.
So any other closing thoughts? We have just over a minute before we're going to jump back into the plenary session with.
I don't have any, Greg. Do you, Ruth?
No, I don't. Thank you.
No. So you work, I see you have a 269 area code. It must be in the Southwest Michigan
Van
area.
Buren County.
Oh,
Yeah,
great.
Van Buren.
I live in Mattawan, so we're.
Oh, okay. So you're in Van Buren County.
Yeah, I used to work for the county GIS in Pawpaw there with Ted Farr in the administration building.
Okay.
So, yeah.
Yeah.
How long have you been with community mental health?
28 years.
Wow. Outstanding.
So this is quite different.
Yeah.
Some we've never experienced.
Yeah.
And still providing
20
services in
seconds left.
telehealth. Okay. Lots of telehealth services right now. So
Yeah.
we've been able to serve people.
Okay, well, thank you very much for sharing your information and knowledge. We are recording all of this, so we will be posting this back, and we're about to go back to the other room. So
Thank you, Ruth.
all set? Okay, so room 1, would you like to report back?
Yeah, so room 1 focused on should you consider reopening in the fall? And that really touched on 3 bullet points. One was, will you be consistent with state and local orders? The second one was, are you ready to protect children and employees with maybe higher risk to illness? And then how are you screening employees for symptoms? So a few of the areas that we touched on was the district, in breakout room 1 was, obviously they're using the orders from the CDC and guidelines to set boundaries for how they're going about kind of setting their own guidelines. They also kind of looked back at their strategic plan and making sure that they were sticking to that. while also serving, staff and families and how they are blending the two. And then kind of getting the information out to their families and district members. They write Sunday kind of afternoon letters, which gets the info out to the public. And they're going to continue those letters through the summer, just because they don't want families to kind of run into a bunch of surprises when they come back in the fall. So just staying open with the community. They also sent out surveys to all their families, asking questions about, like, do you have any pre-existing conditions that would prevent you from feeling safe? And really they got about 20% of respondents noted that there was some kind of concern. So they also are offering options. So remote learning for families, or, telework, maybe possibly. They are using kind of all the data that they collect to better understand what plans may look like in the fall. They're also meeting with other local superintendents frequently in hopes that all the districts kind of locally in that area or in the county operate the same way. And they're doing that so that families don't decide to shop for a school maybe that's a little bit safer. So I thought that was interesting. And then how are they screening employees? They're hoping for some sort of free app that allows them to collect that information and have that protocol on how they go about if somebody, does answer a question, that they aren't feeling well or whatnot, and how they document all that. So those were just a few kind of other bullet points for Breakout Room 1.
Thank you very much. Were there any comments or questions about Room 1? And we're coming up, we have about 10 minutes left, so I did want to make sure we could get through the other two rooms. So Room 2, can you report back?
I can. We had some nice discussions. First of all, we had Catherine from Battle Creek, a trustee there, and also Mary, Chippewa Hills board president, and Margaret, a school board secretary from Centerville, and of course Sarah. So first of all, Mary made some comments, good comments about the fact that this is a moving target right now. So they're doing the same thing. They're getting community input and doing the actual committee work too. But they're doing making sure about the safety on the bus. Chip Hills has a huge bus route system. It's the biggest besides possibly Alpena in the lower Michigan. So that's something that's going to be a big challenge for them. And then the discussion went to how would we accommodate with that much busing, and how would we make sure that it was safe on the bus. So some of the issues were to possibly even have parents that would check on the students, on their own children before they left, and to be able to deal with that. And if we saw some indication of some illness at school, then possibly be able to go ahead and do some other diagnostic and to see if that student is indeed sick or not. But we also pretty much came to the agreement that I think parents are going to be, well before even would be hesitant to send their kids to school if they were sick. I think they'll be even more vigilant not to do so in the future. So hopefully we'll be able to mitigate some of those logistic issues. We also had meetings about, or discussions about the fact that, well, first of all, Sarah mentioned that from Canada, where she's from, they have the same issues with busing. So we're kind of having those same issues across, probably internationally. One of the things you can do is have students wear masks rather than the 6 feet guidelines, physical distancing guidelines. So that might be a remedy for that. We also talked about the fact that Catherine brought up the idea about the fact that the committees are looking into the fact of how do you deal with this logistically. And one of the big issues coming out from that so far, even on the front end, is how do you get enough people to actually, take care of the environment as far as cleaning it up after students and staff use the environment for a day. And then it kind of brought the conversation back to the idea of, are we going to have those rooms being used more than once a day, or are staff going to use the rooms more than once a day? And, frankly, there's very little direct answers right now we have for that, except for possibly the mask piece and, being very careful and vigilant and being very thoughtful about having maybe only one class, especially in elementary, within one environment, one classroom environment, and not being so
having extravagance to being able to have, students move around quite as much as they have in the past. We did talk again about the spray mist disinfectant that some schools are using that makes it a lot faster, but it probably wouldn't work between class periods, at least to my knowledge. So I wanted to get that all in quickly because we're running against time issues right now, but if there are any questions, I'd be happy to try to answer those or to keep the conversation going, but I know we're pressed for time.
Okay. Thank you very much. And the last room was on step 3 that really was about ongoing operations and having monitoring in place. One of the issues that was discussed had to do with mental health professionals and others that may need to work in more than one building. And so they may have to go from building to building to be able to work with students and how that can be tracked. We did talk about some of the technology that's available to help with health screenings at the door. One of them, I think everybody has seen the no-touch thermometers where you can do an infrared screening on their temperature. Ryan also mentioned that there are some thermal scanning imagery that could be used on cameras to be able to help that as well. There's quite a bit of discussion about the policies that need to be in place and how the CDC is recommending that there be more flexibility, that things like number of days off, teaching staff usually have a limited number of days they take. But if somebody gets sick and you don't want them in, you may need to be flexible in what that policy is. The same thing with absences for students. It's more of a staffing issue with teachers that you may need to have more substitute teachers available in case teaching staff get ill and aren't able to work inside the school. And so we had quite a bit of discussion about that as well and the flexibility of the policies. And then we also talked about the need to be able to share information across platforms. So right now, the state, local, county governments are working pretty well to provide information online about individual cases and where there might be hotspots within the state. That needs to cross over and work with the schools so that the information can be shared on a school-by-school basis too, so that parents know if there is an outbreak in a school, or if, and so that both the local government can communicate with the schools and the health department can understand what the needs are. So there really needs to be some type of platform that both the state, local, county governments, as well as school districts are able to share the information from, especially as the school year gets started. So that was most of our discussion in room 3. Anybody have any other comments on that? So we are right up against our time here. So we have covered all 3 steps in the CDC reopening decision tree. Thank you very much for everybody for participating. Obviously, some of these things are going to cost more than others, and there's a real question about how schools are going to be able to afford it. And so our next town hall is 2 weeks from today. We're planning on meeting on July 1st, and the topic of discussion is going to be focused on a report that was issued by AASA and ASBO nationally. They put together a report on what they expected the average school to incur expenses to meet all of the CDC guidelines in particular. And so we wanted to have a discussion about that and really understand what the cost implications of that were going to be. So thank you all for coming. If anybody has any questions, we do have the information email if anybody wants to send questions in. It's info@gowightman.com. If you have any comments or questions, please let us know. And we will send out a link to our website that will have both a written summary of this work session as well as the video on our YouTube channel if anybody would like to watch that later. So thank you all for coming, and we hope to see you again soon. Thanks.
Thank you.
Thank you very much.
So we did want to go through each of the breakout rooms and have them report back on what they discussed in the breakout room. So Christine, are we close to having everybody back? You're muted, but
Yes, we are.
all set? Okay, so room 1, would you like to report back?
Yeah, so room 1 focused on should you consider reopening in the fall? And that really touched on 3 bullet points. One was, will you be consistent with state and local orders? The second one was, are you ready to protect children and employees with maybe higher risk to illness? And then how are you screening employees for symptoms? So a few of the areas that we touched on was the district, in breakout room 1 was, obviously they're using the orders from the CDC and guidelines to set boundaries for how they're going about kind of setting their own guidelines. They also kind of looked back at their strategic plan and making sure that they were sticking to that, while also serving, staff and families and how they are blending the two. And then kind of getting the information out to their families and district members. They write Sunday kind of afternoon letters, which gets the info out to the public. And they're going to continue those letters through the summer just because they don't want families to kind of run into a bunch of surprises when they come back in the fall. So just staying open with the community. They also sent out surveys to all their families, asking questions about, like, do you have any pre-existing conditions that would prevent you from feeling safe? And really they got about 20% of respondents noted that there was some kind of concern. So they also are offering options. So remote learning for families, or, telework maybe possibly. They are using kind of all the data that they collect to better understand what plans may look like in the fall. They're also meeting with other local superintendents frequently in hopes that all the districts kind of locally in that area or in the county operate the same way. And they're doing that so that families don't decide to shop for a school maybe that's a little bit safer. So I thought that was interesting. And then how are they screening employees? They're hoping for some sort of free app that allows them to collect that information and have that protocol on how they go about if somebody, does answer a question, that they aren't feeling well or whatnot, and how they document all that. So those were just a few kind of other bullet points for breakout room 1.
Thank you very much. Were there any comments or questions about room 1? And we're coming up, we have about 10 minutes left, so I did want to make sure we could get through the other 2 rooms. So room 2, can you report back?
I can. We had some nice discussions. First of all, we had Catherine from Battle Creek, a trustee there, and also Mary, Chippewa Hills board president, and Margaret, a school board secretary from Centerville, and of course, Sarah. So first of all, Mary made some comments, good comments about the fact that this is a moving target right now. So, they're doing the same thing. They're getting the input and doing the actual, committee work too, but they're doing, making sure about the safety on the bus. Chip Hills has a huge bus route system. It's the biggest besides possibly Alpena in the lower Michigan. So that's something that's going to be a big challenge for them. And then the discussion went to how would we accommodate with that much busing, and how would we make sure that it was safe on the bus. So some of the issues were to possibly even have parents that would check on the students, on their own children before they left, and to be able to deal with that. And if we saw some indication of some illness at school, then possibly be able to go ahead and do some, other diagnostic and to see if that student is indeed sick or not. But we also pretty much came to the agreement that I think parents are going to be, well, before even would be hesitant to send their kids to school if they were sick. I think they'll be even more vigilant not to do so in the future. So hopefully we'll be able to mitigate some of those logistic issues. We also had meetings about, or discussions about the fact that, well, first of all, Sarah mentioned that from Canada, where she's from, they have the same issues with busing. So we're kind of having those same issues across, probably internationally. One of the things you can do is have students wear masks rather than the 6 feet guidelines, physical distancing guidelines. So that might be a remedy for that. We also talked about the fact that Catherine brought up the idea about the fact that the committees are looking into the fact of how do you deal with this logistically. And one of the big issues coming out from that so far, even on the front end, is how do you get enough people to actually, take care of the environment as far as cleaning it up after students and staff use the environment for a day. And then it kind of brought the conversation back to the idea of, are we going to have those rooms being used more than once a day, or are staff going to use the rooms more than once a day? And, frankly, there's very little direct answers right now we have for that, except for possibly the mask piece and, being very careful and vigilant and being very thoughtful about having maybe only one class, especially in the elementary, within one environment, one classroom environment, and not being so having extravagance of being able to have, students move around quite as much as they have in the past. We did talk again about the spray mist disinfectant that some schools are using that makes it a lot faster, but it probably wouldn't work between class periods, at least to my knowledge. So I wanted to get that all in quickly because we're running against time issues right now, but if there are any questions, I'd be happy to try to answer those or to keep the conversation going, but I know we're pressed for time.
Great. Thank you very much. And the last room was on step 3 that really was about ongoing operations and having monitoring in place. One of the issues that was discussed had to do with mental health professionals and others that may need to work in more than one building. And so they may have to go from building to building to be able to work with students and how that can be tracked. We did talk about some of the technology that's available to help with health screenings at the door. One of them, I think everybody has seen the no-touch thermometers where you can do an infrared screening on their temperature. Ryan also mentioned that there are some thermal scanning imagery that could be used on cameras to be able to help that as well. There's quite a bit of discussion about the policies that need to be in place and how the CDC is recommending that there be more flexibility, that things like number of days off, teaching staff usually have a limited number of days they can take. But if somebody gets sick and you don't want them in, you may need to be flexible in what that policy is. The same thing with absences for students. It's more of a staffing issue with teachers that you may need to have more substitute teachers available in case teaching staff get ill and aren't able to work inside the school. And so we had quite a bit of discussion about that as well and the flexibility of the policies. And then we also talked about the need to be able to share information across platforms. So right now, the state, local, county governments are working pretty well to provide information online about individual cases and where there might be hotspots within the state. That needs to cross over and work with the schools so that the information can be shared on a school by school basis too, so that parents know if there is an outbreak in a school or if, and so that both the local government can communicate with the schools and the health department can understand what the needs are. So there really needs to be some type of platform that both the state, local, county governments, as well as school districts are able to share the information from, especially as the school year gets started. So that was most of our discussion in room 3. Anybody have any other comments on that? So we are right up against our time here. So we have covered all 3 steps in the CDC reopening decision tree. thank you very much for everybody for participating. Obviously, some of these things are going to cost more than others, and there's a real question about how schools are going to be able to afford it. And so our next town hall is 2 weeks from today. We're planning on meeting on July 1st. And the topic of discussion is going to be focused on a report that was issued by AASA and ASBO nationally. They put together a report on what they expected the average school to incur expenses to meet all of the CDC guidelines in particular. And so we wanted to have a discussion about that and really understand what the cost implications of that were going to be. So thank you all for coming. If anybody has any questions, we do have the information email if anybody wants to send questions in. It's info@gowightman.com. If you have any comments or questions, please let us know. And we will send out a link to our website that will have both a written summary of this work session as well as the video on our YouTube channel if anybody would like to watch that later. So thank you all for coming, and we hope to see you again soon. Thanks.
Thank you.
Thank you very much.
We're gonna have a great day.